Adult Hypertension Uncomplicated Outcome Documentation.
What is adult hypertension uncomplicated outcome documentation?
This module will cover how to use eCW to document the note for a patient who has a hypertension diagnosis. We will cover required documentation in vitals, medications, HPI, problem list, labs, along with using the order set to print patient education and place orders, and how the CDSS alerts will provide reminders.
Okay, where should we start?
Let's talk about the responsibilities of your clinical staff. When the patient comes in for a visit, your staff should collect vitals, which include the blood pressure, height, weight, and verify the BMI is calculated. Next, they will need to verify all current medications. Finally, if the patient is currently on a medication for high blood pressure, they will need to document the blood pressure medication usage in HPI. Let me show you each of these steps. From the progress note, click on Vitals. In the blood pressure, height, and weight fields, document the vitals for today's visit. Check to make sure the BMI calculated. Check vitals taken. Now select current medication from the progress note. Enter any stop dates as needed. If the patient has started a new medication, click on Add and select the medication to add to their current medications list. Click Medications Verified when done. If the patient is currently taking a medication for hypertension, you will need to complete the Structured Data section under HPI. Select HPI on the progress note. Under the Total Health category, select Hypertension. Click on BP Medication Usage. If the patient is compliant with taking their hypertension medication, select Yes from the drop-down in the Value field. If the patient is non-compliant, select No. Then click the Notes section and select the reason the patient is non-compliant. This completes the clinical staff's requirements for documenting adult hypertension.
As a provider, what am I responsible for?
Reviewing vitals, completing the hypertension care plan, ordering medications and labs, documenting the problem list, and providing patient education. Let me show you. First, you will want to review the vitals entered by the clinical staff. If the BMI is out of range, provide a plan and document by going down to Preventive Medicine and enter the Meaningful Use Counseling. Next, you will need to document the hypertension care plan in HPI. Select HPI on the progress note. Using the Total Health category, select Hypertension. Click on HTN Care Plan. From the drop-down in the Value field next to Discussed with Patient, select the options that apply and click Add. This is how it will look in your progress note. Now be sure the patient has a diagnosis of hypertension in their problem list. If one has not been previously added, you can add it either from the assessment window by entering your diagnosis in the lookup window and selecting the proper assessment code. Once selected, it will appear in the lower half of the window. Here you click on the box next to the assessment code and it will be added to your patient's problem list. Or, from the problem list located in the right chart panel, click on the orange ellipsis button. This will open the problem list, and you can add your patient's diagnosis from here to their problem list.
Now, if my patient does have hypertension and I need to add medications, is there anything special I need to do or know?
If the patient's blood pressure is greater than or equal to 140/90, you will prescribe 1 or 2 antihypertensive medications, or a combination medication using the Multum database in the treatment window and evaluate their effectiveness and adjust as needed. To do this, select Treatment on the progress note. Click on Add next to RX. Check the hypertension diagnosis. Make sure you're on Multum RX and search for the RX name. Select the RX to add to the treatment window. Adjust strength, formulation, take, frequency, duration, dispense, and refill as needed. For PQRS reporting, keep in mind that patients who do not have controlled blood pressure of less than 140/90, PQRS/JNC7 recommends that the patient be placed on 2 antihypertensive medications. Patients who have controlled blood pressure of less than 140/90 without complications, who are taking only 1 antihypertensive medication, may not qualify for PQRS reporting.
Are there any specific labs I need to order, and how often am I required to do so?
The LDL-C cholesterol must be measured once every 12 months and resulted in the EHR. The standard goal is an LDL-C of less than 100 milligrams per deciliter. To do this, select Treatment on the progress note. Click on Browse next to Labs. Check the hypertension diagnosis. Search for lipid profile and select.
What can I do from the order set?
You can utilize the order set to place orders for medications, labs, or to print your patient education. To do this, click on the red order set icon at the far right top toolbar in the treatment section. From the order set drop-down, scroll down to .ZA Adult HTN Uncomplicated. To order medications for the patient, check the box next to the medication and click on the Order button. If you would like to order the LDL-C, select the lab and click on the Order button. You may print patient education from the Patient Education section of the order set. When you order the PDF, the title will be documented in the progress note. Click on the PDF icon to print and give to the patient. This process will count as education for meaningful use.
Did you say there would be CDSS alerts for hypertension?
Yes, a CDSS alert that will help you manage the patient's hypertension is available in eCW. To view the CDSS alerts that have not been satisfied, click on the CDSS tab in the right chart panel. Click on the question mark to view the alert details. To view both satisfied and overdue alerts, select CDSS on the patient dashboard. The alert will remain active or red until the patient's blood pressure is less than 140/90. Once the BP is less than 140/90, the alert will be satisfied and turn green. EHR support, how can I help you?
Hi, I've completed my education on adult hypertension and wanted to know if any of my hypertension patients are excluded from this process.
Possibly. Exclusions include those diagnosed with evidence of end-stage renal disease on or prior to December 31st of the measurement year. Documentation of dialysis or renal transplant meets the criteria for evidence 3 of ESRD. Pregnant patients who were pregnant during the measurement year, patients who had an admission to a non-acute inpatient setting anytime during the measurement year.
Thank you. That answers my question. I'll call back if I think of anything else.
For questions regarding the information shown, contact the EHR support team via Bridge Access on GHSNet.